So let's talk more about where things stand on this Obamacare repeal replace with former Chief of Staff to Republican Senator Ted Cruz and current director of the Center for the 10th Amendment Action at the Texas Public Policy Foundation, Chip Roy. Thanks for joining us, Chip. We'll talk about Secretary Price's comments in a moment, but we just got a readout from the Republican conference call today where essentially the bottom line is they don't expect a vote on a bill on repeal replace this week. Why do you think there was so much energy drummed up only to now backtrack again?
Sure, Anna. Well, first, thanks for having me on today, and good afternoon. There's been a lot of discussions over the last 2 weeks over the Easter recess, and a lot of headway has been made and good conversations have been had. And look, for all of the vicious attacks that a number of Republicans have levied against the House Freedom Caucus, the House Freedom Caucus has been working in good faith to try to reach a consensus on what would be acceptable for them to make sure that we drive premiums down, which is one of the chief concerns. And so I think that there's been a lot of energy towards having a vote and moving towards something when they get back. But as I think Secretary Price just mentioned in that package, part of the problem in the first instance is that they were rushing it through, much like some of the concerns we had with Obamacare in 2009. And so I actually applaud it if they're not going to come back and rush through a vote next week. They need to take their time and have the conversations needed to try to get this done.
Maybe they learned a lesson, but you talked about Freedom Caucus maybe getting more of what they want in this upcoming legislation. But let's hear from a Republican Congressman, Rodney Stone. He's a member of the Tuesday group who is working on those negotiations with the Freedom Caucus. Listen.
I'm not going to be for a plan that's going to allow for pre-existing conditions to not be covered. Waivers are going to can be requested, but that doesn't mean they're going to be. And they are very limited in this discussion. And if that becomes the discussion point, the key thing, we lose sight over the fact that we are talking about covering pre-existing conditions.
So if comprehensive coverage is not mandated or a requirement or part of the regulations for insurance companies, that is the big question is, will people with pre-existing conditions have adequate insurance coverage? How do you see that squaring up?
Sure. And look, Anna, I know you spend a lot of time raising money for cancer charities and trying to help people with cancer. 6 years ago, a tickle in my throat turned into Hodgkin's lymphoma. And I've, Lord willing, I've been 5-year clear, and so I care about pre-existing conditions immensely. I believe, and I think the House Freedom Caucus believes, that we need to ensure that people have access to affordable health care, get the care that they want from their doctors, and be able to get insurance in the free market and drive premiums down. Our concern all along has been that the proposal that was put forward won't do that. And in fact, the CBO was predicting premiums would go up. So what the House Freedom Caucus has spent Easter doing is trying to get the Tuesday group to come to the table to embrace policies that we believe will try to drive down the cost of premiums.
Which sounds good, but how are you going to drive down the cost of premiums and still provide enough coverage for everybody?
Well, sure. The answer lies in getting competition by getting rid of the regulations that are driving up the cost in the first place, and then, as they're trying to discuss now, have high-risk pools and methods by which you can, state by state, provide options for people who have pre-existing conditions.
So you're going to give the states the responsibility to have to figure out how those people who need more coverage or have more expensive health care costs are going to cope?
Well, I think there would be what's on the table is a federal high-risk pool option as well as states being able to do it. But look, a lot of the states want those options. A lot of states want to be able to come up with solutions for the people in their state, including block granting Medicaid to the states so that you can take care of those people who need care in Medicaid rather than jamming so many people in the Medicaid system who are able-bodied and leaving the sick off of the rolls, which is what Obamacare does. That's the problem. We are driving up costs by forcing people into Medicaid system and by putting so many regulations on the insurance products that nobody can afford the insurance. That's what the House Freedom Caucus is trying to do, is make sure that we can get the market forces in there to drive down costs of the premiums.
All right, Chip Roy, thank you.
Anna, thanks for having me on.
CNN has more details.